Hey everyone, here we are into tissue response to injury, so finishing up chapter 1. So you should have already done kind of our welcome, a little bit on stresses, review of the various body tissues, and now this should hopefully be review from intro class on tissue response to injury. I love this chapter. I'm weird like that. This is like one of my favorite things to teach, and I didn't get to teach intro to you guys, so you get to hear all my really lame analogies for this process. The project that you did for intro, where you had to create a story or do something, that is my favorite assignment that I've ever designed, and I'm really glad Liz made you do it again. We're going to pull those back out and do some stuff with that in class because it really is just awesome to be able to understand what the body is doing. Okay, so yeah, I'm a dork. I love this. Let's go. So when we talk about injury, it tends to go hand in hand with inflammation, especially to people who don't understand. And hopefully by now you remember from intro class that inflammation is not the bad guy. Okay? That's going to be really important as we go through this process. Inflammation has pros and inflammation has cons, and our job, remember thinking back to being a clinician, our job is to understand what that balance is and help the body achieve that balance in the best possible way, which sometimes means just telling our patients to take it easy. Okay, and that's going to be part of this conversation. Now, when we have an injury, we usually talk about the primary injury, okay? That is the tissue destruction, that's the traumatic force. So the little diagram that's in your book and on the screen, we have that primary trauma. That primary trauma can be microscopic or macroscopic, so something you could see a broken bone, or it can be stress fractured, or it could be something small inside the body. But either way, we have everything that occurs, cell death. And what happens with cell death is then we start that inflammatory process. And the pros are kind of over on the right side, the cons are kind of over on the left side. And so our job is to help to hopefully push this over to the right more so that we can get to that return to normal function and follow our process on the tissue response to injury. The problem gets, and if you look over on the left, is we really get into this cycle. You can see the arrows circle back up to cell death, which we don't want. And that gets us stuck in what we call the pain spasm cycle, and where we continually re-injure and continually don't recover because we have kind of all these side effects of the inflammatory response cycle. So again, minimizing signs of inflammation is good. We need the process to occur. We never get down to that return to normal function, but we also can't let it spiral out of control. And that can definitely happen if we don't help the process along. So that inflammation is really just a local response of the body to an injury or an irritant, infection, basically anything. And in the very early stages of the inflammatory response process and the tissue response to injury, the body doesn't know. It doesn't know what has happened. It just knows there's cell death and cell damage. And so the body really goes into protection mode so that if this is an infection, hopefully it doesn't spread across the body. Which comes to kind of that function of the inflammatory response process and the tissue response process in general to defend the body against foreign substances. So again, it's going to try to protect the area and then to stabilize the area, dispose of any of the damaged dead tissue so that repair, the area is nice and clean and repair can happen. Now this happens in 3 phases, but they're one continuum. I hope Liz emphasized this for you for intro class too. We're going to talk about it in distinct steps, but that's for our brains to comprehend. It's easier for us to see it that way. These are all happening together. They're all happening over time. They're one big cycle. Not one step doesn't have to be fully done for the next step to start. And so you got to think of it as kind of this ongoing process versus these distinct steps. But we're going to talk about it in the distinct steps so that it helps us kind of grasp what's going on. So we mentioned this a little bit earlier too in our past conversation that we are much more likely to impede the healing process as we are to accelerate the healing process. So again, our understanding, being a good clinician, knowing the science behind all of this, helps us to make the proper decisions and guide our patients into making the proper decisions to push us over onto that right side of that diagram and away from the left side of the diagram. So again, our three phases: the acute inflammatory response phase, that's what we're going to hit on first. That is that initial, let's get this area locked down, let's clean it up. The proliferation, or it's sometimes called the fibroblastic repair phase, is then repairing the area kind of quickly in the most stable way possible at that time. Then the maturation phase, where we actually are trying to make that area as functional as it possibly can be, as close to the initial original tissue as it can be. So let's talk a little bit about how we know what phase we're in, because all this is happening inside the body. You know, if we have a cut on the skin, we can kind of follow and see the healing happen. But if we're talking about an ankle sprain or a quad strain, we're not able to see this. What we can see are what we call the signs of inflammation. So again, hopefully this is review for you. It's sometimes called the cardinal signs of inflammation. I don't like to call it that because cardinal goes back to being 4. It's about the cardinal rows on a map. And there are 4, but technically we've now included 5. And so I will always talk about the 5 signs of inflammation. These will come back. You will have to tell me these every single time you do a competency with me, every single time you do a practical with me. What are the 5 signs of inflammation? How can we use those to determine what stage our patient's injury is in? Okay? Because again, these are the macroscopic things. These are the things we can see, feel, touch, experience, versus what's actually happening on the cellular level. So the 5 signs. First, we have heat. Heat is, or warmth, you can call it either way, is a result, and all of these signs of inflammation, they're all results of what's happening on the chemical level and the cellular level. So we're going to get into the steps. All those steps are going to lead to what we can see here. So the heat or the warmth, sometimes also called calor, if you're talking Latin, if you're going to take med terms, you'll learn all kind of the Latin for everything. So calor, heat, increased blood flow, increased metabolic rate. So that blood flow coming to the area, it's warm, it's blood. So we feel that warmth. Metabolic, so as the cells ramp up their energy and using their energy like they would to try to clean this area and repair this area, we feel that leftover, that expelled energy as heat. Okay. Then we have redness, okay, or rubor. So the skin takes on kind of a reddish tone. And that also, think of that increased blood flow as the blood vessels dilate and they get closer to the skin. We see that redness. You see that in your face when you work out or exercise. Also that increased metabolic rate. Histamine is one of these chemical mediators we're going to talk about. Histamine is that same reaction that you get when you have an allergic reaction. So when you get hives, when we think about someone being allergic to bee stings. So that histamine release is also going to redden the skin. Next we have swelling or tumor. And swelling is that increased in fluid in the area. And we're going to spend a lot more time talking about swelling later in this section. But it's basically because of the process of the inflammatory process, because we need to get these cells to the area and these chemical mediators to the area, a byproduct of that is fluid leaking out of the vessels into the cellular matrix of the area. And so we see that as swelling. So usually, again, due to the hemorrhaging, due to all this increased protein, all the free proteins floating around, the damaged cells, all that, when you think back to, fluids and their flow across a membrane, they're going to go to the areas of highest concentration of solids and salts. And so as all this damaged area sits there, we're going to pull a lot more fluid into that area. Pain or dolor is really important in this process. We tend to think as pain as we want to decrease pain. We don't want the person in pain, and that's true because of getting into that left side of that cycle and being negative over there. But pain is our warning sign. Without pain, we keep doing stupid things and we keep injuring the area. So we need to listen to pain. The whole no pain, no gain thing, that's one thing in strength and conditioning. It's a very different thing in injury care and prevention. Okay, so the actual mechanical pressure on the nerves, the destruction of those nerve fibers, chemical irritants. So again, histamine and all of these, they're purposely going to irritate the nerve endings so that we experience pain, so that we stop it, so that we lock down the area. Okay. And then the fifth one is loss of function, or functio lasse. And that is a result of all the others. So because we have this primary tissue damage, obviously those cells, if nothing else, don't function the same way. There's a loss of function. However, then as this becomes more macroscopic, we have a loss of function in the things that we can see, like lack of range of motion, or the gait being off, or things like that, muscle guarding. So these are the things that tell us that we are in the inflammatory response phase, the first steps in this tissue healing. And so if we see these, we need to pay attention, and we need to be doing different care than we're going to be doing later on. Okay? Again, being able to think and to apply this and realize that not everything's going to be the same. We will give time frames just for your knowledge, but realize that every individual, every condition, every injury is going to act differently, and we cannot rely on those time frames. So even though we say the inflammatory process should be 24 to 48 to 72 hours, that could be 100% true. It could take 12 hours for someone. It could take 3 days, 4 days, 5 days, a week for someone. So we need to follow these signs of inflammation to understand where in the process we are. Okay, next up we have the stages of inflammation. So again, giving time frames for things is tricky, but for the most part, we can target the acute inflammation, and that's what we want to see. We want to see the individual go through the acute inflammation and then get to the subacute where things are starting to diminish, to know that we're getting into the repair phase of the process, that we're moving forward. If we don't see that happening and we eventually start to get in the chronic, where we get this unwanted inflammation, that's going to be a problem. So acute tends to last, it's the reaction to the injury, tends to last somewhere between 0 and 14 days. So that's getting us into the repair phase usually. The subacute symptoms are starting to diminish, and that takes about 14 days to a month, 30 days about. And then chronic is usually anything over 31 days, or what's past what we would expect for this type of injury. The other thing to keep in mind before we move into talking about the steps is that the inflammatory response phase, this first stage of the tissue healing, is going to be divided kind of into two different categories. We have the hemodynamic changes, which are changes in the blood vessels. So that's going to be from the vasoconstriction to the vasodilation, to then eventually how we, shut down those capillaries, build new capillaries. We're going to have lots of changes in the hemodynamics. Same with swelling and how the blood vessels open up, the increased permeability, what happens to those blood vessels. We then also have the cellular function. And the cellular function is usually altered because of the presence of pro-inflammatory mediators or the anti-inflammatory mediators and the balance between them. So again, cellular membrane permeability, we're going to talk, again, the nerve stimulation, things like that. So as we move into talking about the injury and the inflammatory response phase, one thing to keep in mind is that hemorrhage is a natural part of this process. Hemorrhage is just bleeding. And if we have a primary injury, we're going to have capillaries disrupted. And so we're going to have a vessel that loses its continuity. Okay? That's one way we get hemorrhage, and that's what we sometimes call direct hemorrhage. And that's going to be something that we probably can't control, because that's going to happen within seconds to minutes after the injury. And we'll talk more about that as we get into talking about the secondary effects of injury. What else can happen to cause hemorrhage, okay, is that increased permeability where cells and fluids can escape either from the cell itself or from the blood vessels and collect in the extracellular matrix, kind of in the tissue area. This is usually the result of the chemical mediators that we're going to see in the inflammatory response phase. They're going to increase that permeability. So that usually becomes, if we're going to focus on that and trying to reduce the hemorrhage, that's what we can focus on, is how can we keep as much fluid in the healthy cells and in the blood vessels as possible. So when we see hemorrhage, we have subcutaneous hemorrhage, so kind of right below the skin surface. That's what we normally see as ecchymosis. And then you have deeper hemorrhages, which we tend to call hematomas, and those can take hours to days for that color to kind of work its way up that we can see it, but that doesn't mean it's not there. Okay. Now, are hemorrhages good or bad? I would think most of the time we'd be like, yeah, bleeding's not good. We don't want to see bleeding. It actually has a role. So in the short term, hemorrhaging assists the healing process by kind of equalizing the pressure gradients. We're going to see this pressure change that happens between the tissue and the blood vessels. That's going to want to pull a lot of fluid out. The hematoma sitting there actually helps reduce that, kind of equalize that pressure gradient. It also limits the amount of blood loss. It's putting pressure on the capillaries itself, so it kind of holds the blood loss in. However, in the long term, not good. That hematoma, if it sits especially deep in a muscle, we're going to restrict motion. It's going to hinder the repair process and kind of keep the inflammatory process going, which is then going to put us in kind of that chronic inflammatory phase, or that left side of that cycle. Okay, so we're going to move on in the next video to talking about the inflammatory response phase and its steps.